With our aging population, the need for businesses like this Madison County-based business is growing exponentially. And now, this organization is making a substantial financial investment in Madison County. For years, you knew them as Community Hospital's long-term care facilities. But now, reorganized, Essential Senior Health and Living is making more commitment that they are here to stay. We're visiting with Beth Harp, president of Essential Senior Health and Living, who will ask about the investment shortly. But first of all, Beth, what about the change of name?
Well, it's been a couple of years ago now. We, as an organization, met with our board, and, we've been affiliated with Community Hospital Anderson for many years, and they were getting ready to go through a transition and change with the Community Health Network. So when they were going through that transition, we felt like it would be best as a nursing home group that is separate from a hospital group, that we remain independent. And so we are still very close partners with Community Hospital Anderson and Community Health Network. But we decided, and our board decided, that it was in our best interest as a nursing home group to remain independent. And so we reconfigured our board and updated our bylaws and basically transitions to Essential Senior Health and Living. And that encompasses Northview Health and Living, Summit Health and Living, and Elwood Health and Living. So we are still community long-term care, because that's who we were prior to even being affiliated with Community Hospital, but we do business as Essential Senior Health and Living.
What was interesting as we scheduled this interview in the middle of a pandemic crisis, yet the facility is expanding. So that has to be a good sign. So let's talk about the growth of the organization now.
Yeah, so we actually have had this project we've been working on for the past several years. And so, of course, last year we were supposed to break ground and get things going, and then COVID hit. So we had to push things off, and we were able to break ground in May of this year and move forward with a 2,500 square foot therapy gym. Because, when the facilities were built, they were really built as nursing homes, not as rehab centers. And now, as healthcare has evolved and hospitals are discharging people much sooner, we are now really an extension of the hospital as far as rehab goes. So the facility, we've been doing rehab in an old sun porch is what we converted to our rehab space, and just have really outgrown that over the years as our therapy has grown, and word of mouth has spread about the good outcomes that we have here in our therapy department. So adding this 2,500 square foot therapy gym will be amazing for the therapists to be able to really have the space, the state-of-the-art equipment, and those things that they need, to continue to provide that service for the community.
And let's talk about the construction of it first of all, and then we'll talk about the amenities of it. From the construction standpoint, you're using Indiana companies.
Mm-hmm. Mm-hmm. We have BW Construction is managing the construction piece of that, and they've got some local contractors that they've partnered with and are utilizing for the different aspects of the gym. We actually are working with an Ohio company that is the project manager, and the only reason that we're doing that is because when we started this project initially, there was another service line that was going to be a part of that, and they are connected with this Ohio group. And so when we were moving forward and that piece didn't move forward with us, we still stayed with that group just because we had started with them initially. And then we've got BW on board, and they actually help with the project that we are doing over in Elwood as well. So there's been a real good collaboration between those two to try to help make sure that we are utilizing local vendors wherever we possibly can. So
you mentioned a project in Elwood. Let's talk about that if we can.
Yeah, so actually, with COVID hitting last year, we were supposed to start doing renovation in the facility there at Elwood Health and Living, and renovating really from the front of the building all the way to the back, updating all the rooms, redoing our therapy space there, updating our kitchen. But last year, we ended up having to do everything outside the facility because of COVID. So we added a beautiful covered awning so that when people come and they're dropped off for appointments or picked up, or families are coming in to visit, they can pull up underneath the covered awning and be out of the weather and out of the elements. So that was a nice addition. And then we also added several courtyard spaces. So we have a memory care unit, Quincy Corner, that we added in May of 19, and we were able to add a secure courtyard last year there. And then we have another courtyard area for our long-term residents with a gazebo and flower gardens and everything that they can go out and enjoy. So those were the projects we did last year. And now this year, the second phase at Elwood, we will be starting with completely updating and renovating the kitchen and dining space, and then just working our way through the rest of the facility to renovate. So we're very excited about all the growth and progress that we're continuing to see.
Back to the rehab facility at Anderson. Let's talk about it, what it's going to offer. You mentioned that it's definitely an upgrade from what you had before, but let's talk about this facility and what it has to offer that you wouldn't have had.
Well, we have physical therapy, speech therapy, and occupational therapy. And here on this campus, we actually also have respiratory therapy in-house that we are able to offer. So with the new space, we'll continue with all those services, but we'll have some additional equipment that we can add in that will just help, with them being able to offer just more intensive therapies. We currently have e-stim and diathermy and therapies that we can offer, but we'll also now be able to offer those in a separate treatment room that is in the space. And then we also are looking to expand our wellness program for our employees by having equipment and things that they can utilize in that therapy gym after hours before we are working with residents in the space. So it'll really help us be able to expand our wellness program as well for our employees. So right now we do offer outpatient therapy, and typically we do that with residents who have been with us before for therapy and then go home and then they continue to work with us on an outpatient basis. But with having the larger space and the ability to help and care for larger groups of people at a time, we'll be able to offer an outpatient therapy program as well. So,
being situated geographically where you are, how important are these projects to northern Madison County?
You just made my director of business development's day, because really our focus is northern Madison County. All three of our facilities are in northern Madison County, and so I think it'll have a huge impact on the things that it'll bring to not only our employees that live on this side of town, but the residents that are on this side of town. Having a state-of-the-art therapy space in their backyard will be extremely beneficial to them.
Are we able to talk about what kind of an investment this is to the Madison County community?
We've been part of northern Madison County, this community, for nearly 28 years between our facilities, and between the Northview project here and the Elwood project, to really be investing over the next 3 years close to $3 million into our communities so that we can continue to serve this community and be here for years to come.
What about someone who's curious and wants to actually take a tour of the facility and get a feel for the place? Could you talk to that?
We always encourage people to come and tour and meet the staff here, and they can do that anytime, so they don't have to schedule a tour. We do encourage that only because everybody's busy and doing different things. So if we schedule things, it's easier for us to have somebody that can be available and take them through and answer all the questions they might have. But we can tour people at any time. So the best way, if they'd like to schedule a tour, is just to call the facility at 765-203-2699, 62409, and they can ask for Natalie Graves or Candace Poole, and they'll be glad to take them on a tour and show them the different things that we have available and talk with them about our services. Or we have a Facebook page, which is Northview Health and Living, and then we also have our website, which has information about all 3 campuses, and it's just www.essentialseniorhealthandliving.org for more information there.
And we understand completion is set for sometime this October. Beth Harp, thanks to you for the visit today and for your leadership of Essential Senior Health and Living, making our community a better place to live. Thanks for listening. That's the latest buzz of Madison County.